With the new data we get now, with new clinical outcomes, we have much better results than what we could expect it up to now with conventional TACE. For example, in HCC, we have now with the microsphere for the first time, we are talking about curative treatment, about complete response, and complete response not only over 3 months or 4 months, but complete response over more than 1 year. That's something completely true, so that we can think about TACE as a curative treatment, not only as a palliative treatment for an HCC. So for colorectal liver metastasis with a microsphere, it's a new field. But when you look, for example, how these microspheres are now in the treatment strategy of the patient, it's always in a salvage situation. And the result we have with this new microsphere are at a minimum as good as what we have with a third-line treatment. For example, third-line treatment with regorafenib, you have a survival of 6 to 7 months. With a new microsphere, the drug, the beads loaded with irinotecan, we have median survival of about 12 months. That is, for me, a little bit better. Let us have a critical view on European guidelines. Regarding HCC, the TACE is the treatment of choice for a special patient, for patient with intermediate HCC. But we are talking about the conventional TACE, not really about the microsphere TACE. The new data of microsphere TACE show us, for example, complete response is 60–70% of patients. That's something that should be now implemented in the new guidelines. To have this good result with this newer treatment, the microsphere with doxorubicin. For colorectal metastasis, when you look at the new European guidelines, you have anywhere the chemoembolization, but a very low level of evidence, mostly evidence 4 and recommendation B, that is not really reflected what we observe in the daily clinical work that we have. First of all, to be in the guidelines, we need some evidence, and the evidence that we have now with irinotecan microsphere in colorectal liver metastasis is very low. That's the reason TACE is sponsoring a very large study, European-wide observational study, to look at the use of this irinotecan beads, live pearl irinotecan beads in patients with colorectal liver metastasis to get at least a large number of patients in a large registry, just to be able also maybe for the future to define the best study design regarding the interpretation of this result. So CREL is the name of this TACE sponsored study. We look especially at the use of live pearl irinotecan in patients with colorectal liver metastasis. And the only hope we have is that we will get the evidences to have a more important place maybe in the guidelines.